Hello, my name is Michael David, and I'm a student of United States University, MSN 572. And today we're going to do the neurological exam. And I'm here with Miss Jane Doe, who's going to perform the exam with me. And before we get started, I would like to get permission first. So, Miss Jane Doe, I give you full consent on doing this neurological exam with you under recording.
Yes.
Thank you very much. So we get started. So as usual, before we can get started with any examination, we should actually disinfect our hands by washing or by using hand sanitizer. So I'm going to do that right now. Okay, now that my hands are sanitized, we can now proceed with the exam. The first thing that you do when you see a patient in the neuro exam is to check for level of consciousness. So far, Ms. Jane Doe over here appears to be alert. She's awake and alert. She came here with full knowledge of what's going to happen. Nobody forced you to go over here, so she's aware of that. And now that we've established that, we can now proceed to check her orientation. So with that said, we're just going to have to ask a few questions to make sure she's well orientated. So, Ms. Jane Doe, can you tell me your name, please?
Jane Doe?
Okay. And do you know what date it is today?
Yes.
Okay, what's the date today?
February 13, 2022.
Okay. And do you know where you are at the moment? Which state are you at the moment?
Virginia.
Okay. And do you know what we're doing right now?
You're gonna do your assessment, like neurological assessment?
That's correct. So as you can see, Miss Jane over here has answered the 4 important questions when it comes to orientation. So she's well oriented with time, with person, with place, and with the situation. So next we're going to proceed to our next assessment. It's going to be the memory test. We're going to assess her long-term memory and her short-term memory by asking a couple of questions. So Miss Jane Doe, can you recall what you did on your 40th birthday?
I had a birthday party in a restaurant.
Oh, cool. Okay, so that's very good.
Yeah.
So, Miss Jane Doe, what did you have for? Where did you go for your breakfast yesterday?
Oh, just a local cafe in the area.
Very good. So as you can see, her remote memory and her recent memory seems to be intact, and she remembers things from the past and at present. So once we've established that, we can now proceed to her reasoning ability. So I'm just going to ask like a couple of questions and see, or a question or so, and see if she's able to do the right judgment or right call when I ask her the questions. So, Miss Jane Doe, if there's no gas in your car, how are you going to get to work?
Call a cab or a taxi.
Very good. So as you can see, she has the right reasoning, she has the right judgment when asked a situation. So so far her way of thinking and her thinking function is well and intact. So once we're done with cognition tests, we can now proceed to testing the cranial nerves. And to start off, we're going to start off with the first cranial nerve, which is the olfactory nerve. And this test, we are going to we're going to check her sense of smell. Usually we use cinnamon or coffee or any other sense to check to see if there is if her sense of smell is intact or if there's anosmia. At the moment, I don't have anything but a hand moisturizer, which is scented. So I'm going to ask Miss Jane over here to close one of her nostrils, and we're going to test each nostril to see if they're able to smell the hand moisturizer that I'm going to bring forward with their eyes closed. Okay, let's just get the hand moisturizer at the moment. So I've got the hand moisturizer over here. So can you please close your eyes and close your left nostril for me, please? Okay. So you're not gonna see when I'm gonna put this on your nose, but once you detect the scent, say yes, okay?
Okay. Yes.
Very good. Now try the other nose, please. Nostril.
Yes.
Good. You can open your eyes now. So as you can see, her sense of smell seems to be intact. She was able to distinguish the smell with her eyes closed. It goes to show also that her turbinates and her nostrils are not clogged or congested. So with that said, we can now proceed to the next one, which is the optic nerve. With this, we're going to test first her visual acuity by using the Snellen test. So let me just get my Snellen test chart over here. So with the Snellen test chart, we're going to check to see if her vision is is 20/20 at the distance of 6 feet. She's going to have to wear her glass because she has blurred vision. So I'm going to step 6 feet away from you, and I want you to cover your left eye first, and then read the bottom part, which is the 20/20 part over here, and let me know if you can read it and read the letters for me, okay? So I'm going to step off the camera for a while. Okay, Miss Doe, close one of your eyes on your left, cover it up, thank you, and read the last line over here.
LTFPH.
Very good. Now cover the other eye and read the same line.
LTFPH.
Very good. So she has passed her Snellen test, which means her visual acuity with her eyeglasses is good. She was able to read the last line, which is 20/20 vision. So now that we passed that, we can now move to the next one, which is we're going to test her extraocular movements, which are the muscles that control the movement of her eyes. And right now I'm going to use my otoscope and have her focus on the head part, and we're going to see if her eyeballs or her vision is going to follow certain directions to check her optic nerves and see if they work around. Well, technically, she can. The cranial nerves involved in this are going to be the oculomotor, the trochlear, and the abducens muscles. But for the sake of the examination, we're just going to check first and see if she's able to follow the movements or she can focus on the otoscope. So we're just going to check it first, okay?
Do you want the glasses on?
Oh no, just going to focus your eyes first
okay.
and just check. Okay, so she can focus. Next, we're gonna check. Her the back of her eyes, her retina, and check to see if there's any problems there, like any problems with detachment, things like that. So, if you can take off your glasses, ma'am, and I'm gonna check one eye at a time, and check to see if there's any problem inside your eyes. Okay. So I'm gonna turn on the otoscope, and might as well take my glasses off. And we're gonna check each eye. It has to be right eye to right eye and left eye to left eye. And then when you actually hold the otoscope, make sure that your other 3 fingers are actually further apart, so that you can put some distance between the face and the otoscope as well. So let's have a look first. See where there you go, the red eye. All right, there we go. Just look straight. Okay. Now the other eye. Okay. Right. The fundoscopic exam showed no abnormalities in the retina. The disc is good. There is no cotton-wool spots, and there is red eye reflex. So with that, we've concluded that one. So we can move now to the next one, which is the confrontation of the eyes. So I want you to focus on the head of the otoscope. I'm going to get the otoscope closer to you. You just follow it, okay? Okay. So she followed, so she followed the head of the otoscope, and the results are good. So now, pardon me. So now we can proceed now to the next part, which is going to be technically what we did a while ago. Is going to be the extraocular movement, but this time we're going to do it accordingly with the cranial nerves. So right now we're going to do for cranial nerve number 3, which is the oculomotor nerve. So we're going to do the movements, and I'm going to mention which nerves are going to be affected with that, because the extra ocular movements involves at least 3 nerves. So again, if you're going to follow the head of the otoscope, so we can check. So right now we're going to check first the cranial nerve number 3, which is the oculomotor nerve. Okay. So um, the oculomotor, the extraocular movements are being controlled by the, like I said, the 3 cranial nerves, which is the 3, 4, and 6. So the movements from the top, or actually diagonally upwards, are being controlled by cranial nerve number 3. That includes also the downward movements diagonally as well. Now, cranial 4, which is the trigeminal one, not trochlear. I'm sorry, trochlear, is controls the lateral movements of the eyes. So when she looks side to side, that will be the trochlear nerve that's going to be controlling them. Now, for the abducens muscles, or abducens nerve, sorry, that controls the movement of the eyes downwards and diagonal. So inwards and diagonal. So when she looks down and diagonal, that's actually the abducens nerve taking control. So now we're okay with the extraocular movements. We can now check for pupil reflex reaction to light. So what we're going to do is I'm going to shine the light directly to her eyes and check for pupil reaction. we're going to do the direct method first. So I'm going to shine the light straight to the eye that I want to check the pupil. So I'm going to start first with the right eye. Okay, so the right eye is actually constricting well. Left eye now. Okay, pardon me. So the direct reflex reaction is there. They're constricted as soon as the light actually touches it. So now we're going to do a consensual one in which we check for pupillary constriction or reaction. But this time we're going to shine the light on one eye while checking the reaction of the other eye that's not lighted up. So we're going to try it one more time. We're going to shine again the light on your eyes. So we're going to start from the side. And just go look straight, please. Okay. Look straight. Okay. So I shone the light on each eye, and the opposite eye actually, their pupils there actually reacted as well. So it shows that it's actually normal. So now we can proceed to the next test for the oculomotor, which is the testing for nystagmus. We're testing there to see if there's any problems with deviations when they look on their side. So I'm going to use the back of the Snellen chart, and I'm going to put it on one side of the face, and I'm going to make her look on that side, and I'll see if any of the eyes actually deviate from a normal position. So I'm going to start first on your right. So I want you to look all the way to the right. No, the eyes only. Please.
Oh, eyes only?
Yep. Okay, now the other side. Okay. Right, so she followed the directions. She looked on one side and on the other side, and I've checked each eye and see if there's any oscillations or any beats or deviations So far, none showed. She was able to look on the other side with no problems, so she doesn't have any nystagmus at all. Okay, the next one is actually the cranial nerve 4, which is the trochlear one. Um, pardon me. We already tackled that already, the trochlear one. So what we're gonna do now is check again for ocular movements, which is downward inwards, which is the same thing, which she was able to look um, diagonally down. But let's do it again actually. So I'm gonna, you follow this one please. I'm gonna make you look downwards. Oh, no, follow with the eyes. Okay. Can you follow with your eyes? Okay. So she was able to follow down and inwards on both eyes. I'm sorry. Turn it off. So her trochlear movements are actually fine. I didn't see any problem with them. So now we can proceed to the next part, which is the facial muscles or the trigeminal muscles, which is cranial nerve number 5. We're now going to check any facial muscles and check and see her masseter muscles and her temporal muscles and see if there's any problems with her jaw. So what I'm going to do is I'm going to feel her temporal muscles and then her masseter muscle or mastoid muscle. I'm sorry, and I'm going to ask her to open her mouth, close her mouth, so we can see if there's any problem with the jaw over there. So first, I'm going to feel her temporal muscle, and then try open and closing your mouth for me, please. Okay, and now for your mastoids. Open your mouth and close, please. Very good. So there's no actually problem with her facial muscles. She was able to open her mouth without any problems. Her jaw seems to be fine. There's no clicking anyway. So yeah, I mean, everything seems to be fine. So we can now proceed to the next cranial nerve, which is the abducens. But we have already tackled that already. Her abducens muscles are the ones who's controlling the lateral sides when she looks when she did the extraocular movement. So side to side movements is being controlled by the abducens nerve, and we did that already. So we're not going to go through that anymore. So the next one is going to be the facial muscle, the facial nerve. I'm sorry, facial nerve, which is the cranial nerve number 7. This time I'm going to check the muscles on her face by asking her simple commands like, can you please give us a smile? There you go. Give us a frown, please. And then can you puff your cheeks? Very good. So she was able to do all 3, which means her the muscles on her face are very well controlled by the facial muscle or the facial nerve. So since we passed that, we can now move on to cranial nerve number 8, which is the acoustic muscle, or the acoustic nerve, I'm sorry. This time we're going to check her hearing capabilities. We can do that first by doing the whisper test, in which I'm going to whisper a 2-syllable word on each ear, and we'll see if she can repeat those, if she can actually hear them properly. So right now I'm going to start doing that one. We're going to start with the right ear first. So I'm going to say orange.
Orange.
Very good. And the other side, I'm going to go on this side and say
Flashlight.
very good. So she heard me with the whisper test. So we did the 2 syllables. She actually said it back to me. And this time we're gonna get our tuning fork and check for Weber's and Rin's test. So I've got our tuning forks over here. So what we do is hit the tuning fork at the base of the palm of the hand to make a sound and place it in the middle of the forehead. And we're going to check to see if the patient is able to hear the sound equally on both ears. So let's go start now.
Yes.
Cool. So she was able to hear that on both ears, so that's a very good Weber's test. She got positive Weber's test. And the next one is going to be the Rinse test, which we're going to check for bone conduction and air conduction as well using a tuning fork. But the air conduction should be longer than the bone conduction. So we're going to test the bone conduction first, and as soon as the sound is no longer heard, we're going to move the tuning fork in front of her ear to see if the air conduction there is going to be longer. Okay, so pardon me. If you're just going to turn over this side, turn the chair over that over there. There you go. I'm going to check first the air conduction on this side. I'm sorry, I've got a very dry throat. So I'm going to hit it on the base of the palm of the hand. Oh, I put it on the back of the master boil. And let me know when the sound is gone.
Yep. Yep.
Okay. Now I can turn around the side, please. Turn around the chair, and we'll try the other ear.
Yep. Yep.
Okay. So that showed that the bone conduction was shorter compared to the air conduction. So she passed her rinse test. So that's all been good. Now we can move on to the next cranial nerve, which is cranial nerve number 9, which is the glossopharyngeal nerve. And this time we're going to ask her to perform swallowing and test gag reflex as well. Unfortunately, I don't have a tongue depressor, so I can't really perform the gag reflex with her. But we can still ask her to do swallowing. So if you can swallow me for me, please. Okay, so she's able to swallow. As much as I would like to tickle the back of her throat to cause her to gag, unfortunately, I don't have that capability. It's kind of improper for now. So next, we're going to move on to the next cranial nerve, which is cranial nerve number 10, which is the vagus nerve. This time, we're going to check to see if her uvula has movement, and all we can do that by making her say ah. So if you want to tilt your head up for me, please, and open your mouth. Open your mouth all the way, and then say ah. Okay, I can see that the uvula actually moved a bit over there when she said ah. So she passed the cranial nerve number 10. So now we're going to move to the next cranial nerve, which is going to be the accessory nerve. I'm sorry, I'll just play there for a moment. Which is number 11, which is the accessory nerve. This cranial nerve actually takes control of the sternocleidomastoid muscle and also the trapezius muscle. So what we're going to do is I'm going to test the strength of each muscle by me feeling her up on her face, and I'm going to push the other side, and I would like her to actually resist the force that I'm pushing on which direction I'm going to be going. So first we're going to check the sternocleidomastoid. So I'm going to put my hand on the side of your face, which is going to be your right cheek. I'm going to try to push one way, and I want you to push the opposite direction, okay? To see how strong your SCM muscles is, okay? So when I say go, go. Very good. I will try the other side. Straight. Very good. Now, if you turn around, I'm going to test the trapezius muscle now. This is the trapezius muscles over here. So I am going to push one of the shoulders down, and I'd like her to actually counter it by pushing up and see how she does that. So I'm going to push your shoulder down here, and I want you to counter it. Very good. That's very good strength. And now for the other one. Very good. Okay. So far her accessory muscles are working. Her SCM muscle has good strength, and so is her trapezius muscle. So she was able to lift her shoulders up, which means she's also capable of shrugging her shoulders. So now we can proceed to the last cranial nerve, which is going to be the hypoglossal muscle, or hypoglossal nerve, I'm sorry. And the hypoglossal nerve controls tongue movement. So we're gonna ask her to wiggle her tongue around the mouth, like left and right, back, up and down. If you can do it, please, and open your mouth, please, and show me your tongue. And I want you to push up and down, and then side to side. Okay, and now we're gonna test her tongue strength by asking her to um, push your side of your cheek with your tongue. Okay, very good. So her hypoglossal nerve is actually functioning very well. She was able to control her tongue with no problems. Um, if there's paralysis, you won't be able to do that anyway. So we're done with the cranial nerves. We can now we're now going to proceed to the next part, which is going to be testing our cerebral functions, which controls most of her extremities. But this time we're going to check for her lower limbs, and we're going to test for gait for now. So I want you to stand up, please, if you can, and I want you to walk back and forth over here, and we'll see if there's any problems with your gait, if there's any unbalanced stuff. So we're going to start walking, please. And come back. Thank you. So notice that there's nothing wrong with her gait. She was able to walk with good balance. There's no skipping or things like that. Everything seems to be fine. And now we can do some other tests with the gait by doing the tandem walk. So what she'll do is going to be walking heel to toe walking to see if she's able to do that. So I want you to do the tandem walk, please. Very good. Come back. Thank you. Excellent. So she's able to do very good tandem walk. I didn't see any problems with that. Her balance was still good. So next we're gonna go with walking on heels first and see if she's able to balance herself while walking on heels. So I want you to walk on your heels, please. Thank you very much. And then if you can come back walking on your toes this time. Excellent. Very good. So I didn't see any problems with her gait. Her heel seems to be okay maintaining her balance. So is also walking with her toes. She was able to support herself properly with no problems. So yeah, so we did very good on the walking part. Now we can test her arm balance by doing the pronator drift test and the Romberg's test. But first we're gonna try to do the pronator first by putting her arms up and checking to see if she's able to support them without any problems. But first we're going to ask Miss D over here if she can close her eyes for now, and then lift your arms up forward, palms up. Thank you very much. So I'm going to hold that for a few seconds. So as you can see, with her eyes closed, she's still able to support her arms, maintaining them up in a level. Because if one of them drops down, then we'll have a problem with the function. So okay, you can put your arms down for now. So now we're good with the pronator drift. We can now proceed to the Romberg's test. It's almost similar with the pronator one, but this time we're just going to add a little bit of twist to it. So if you can close your eyes, please, again, and lift your arms up. Palms up. Thank you. And then let's keep it up. Okay. You put your arms down now. As you can see, when I actually pushed her arms down, she immediately pushed it back up and in an upright position, which means she's able to support, and she has the strength, and she has the function of able to support herself with no problems with that. So she passed the Romberg's test. So so we're good for that with the cerebral part. So now we can go to the test her sensory senses part. So with the sensory part, we can start with doing joint position. So I'd like you to sit down for a moment. With the joint position, we're gonna test one part of her, one of her distal phalanges, intercostal phalanges, and we're gonna kind of direct them around, and she's gonna close her eyes and tell us which direction I'm going while manipulating her distal phalange. So I'm gonna use the thumb for now because the feet are kind of not really showing well with the camera because we don't have enough space in this area. So if you can give me one of your thumb, please, and if you close your eyes. So if you actually hold the distal intercostal joint of the phalange, which is the middle thumb, and hold the tip with your thumb and your forefinger and just manipulate it. And every time you change the direction, you're gonna have to ask the patient will tell which direction I'm going. So are you ready, Miss D?
Okay.
Okay.
Left, right, up, down.
Very good. So her joint position is good. She was able to determine which direction I was actually manipulating her finger. Um, so now we can proceed to the next one, which is going to be the 2-point discrimination, in which we're going to point certain areas on her skin, on her extremities, and if she can determine how many points I do every time. She can say 1 point, she can say 2 points, but she's gonna have to do it with closed eyes so that we show that we can determine if her sense of touch, her tactile touch, is actually intact. With that, I'm gonna be using a paper clip, which has two distal, the two ends meeting side to side, hopefully, well, around 1 millimeter to 2 millimeters apart. And every time I touch her limb with the paper clip, she will then have to tell me if it's 1 point or 2 points that she's feeling. Okay, so I'm gonna get the paper clip right now. It's right behind you. So all you have to do is get a paper clip or whatever you have, or a piece of wire, and just fold it in half, and you have it. You have something like this, and you're going to kind of touch the skin, and she will tell if she only feels 1 point or 2 points. Okay, so I want you to close your eyes again, Miss D, and I'm going to touch you with this paper clip, and you're going to tell me if you feel 1 point or 2 points. Okay, all right.
One, two, 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 two.
Okay, all right. Um, I did 5 points. She was able to do 4. Unfortunately, the second one was actually 2, but she answered 1 point. Um, it can happen to anyone. I mean, no, I don't know if anybody get a perfect point like that one, but she felt all the points, so that means her tactile responses are there. She's able to feel them. Um, for the feet, though, for the lower extremities, you're gonna have to use a wider um, distance on the points of the paperclip because um, the sensation on the lower extremities are not as sensitive as our upper extremities, especially for people with a peripheral neuropathy with diabetes. They might not feel 2 pricks on their legs when done with a 2-point discrimination. Okay, pardon me. So next we're gonna check for pardon me, sterignosis, in which I'm going to have her patient close her eyes again, and I'm going to give her an object in the palm of her hands or hand, and she would have to identify that without looking. So if you just close your eyes at the moment and open one of your hands, please, for me, and I'm going to put an object down there, and you're going to have to determine what it is. Okay.
A coin.
Very good. So it's a coin. Let's try the other hand again. Close your eyes and open up your left hand.
Or
Yes.
a marker?
A marker, yes. Very good. So, first diagnosis is very good. She was able to determine the objects by mere touch alone without even seeing them. So now the next one we're going to be checking is graphesthesia, in which I'm going to scribble either a number or a letter in the palm of her hand, and she's going to have to determine that without even looking. So let me use this marker, and I'm going to write scribble something on your right hand, and you're going to tell me what it is. Okay?
The letter M.
Very good. Okay. And I'll get it on.
Okay. Hmm. Number 2.
Well, it's actually number 7, but that's fine. Sometimes it can be deceiving depending on how you write it. So it's written upside down, so it's probably kind of confusing for the patient as well. But that's how graphesthesia works. She did the first one was fine. The second one's kind of a bit iffy, but she passed so far. The next one would be tactile. Well, what do we call it? Point sensation. Sorry, point sensation, where we actually touch her skin or any part of the extremities with something, and she will tell us if it's soft or if it's sharp. So I've got a pair of I've got stuff over here. I'm not going to tell her what it is actually, so that she would know. But I want you to close your eyes again, and I'm going to touch something on your arm, and you're going to tell me if it's sharp or if it's soft. Okay?
Sharp or soft.
Okay. We're going to be using these.
Soft. 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 Sharp. 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 Sharp.
Okay. So everything seems fine on her upper extremities. She was able to feel the difference between the sharp and the soft one. We should also try the legs as well, because it could be different from down there and up there. So fortunately, we're gonna have to lift part of your leggings. Okay, I think that would be good. Okay, I hope this camera sees this, so let's try it now. Okay, close your eyes, please.
Soft. 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 Sharp. 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 Soft.
Okay, all right. So she was able to feel almost everything except for one. It was supposed to be sharp, but she felt soft. So yeah, so now we're good with the point sensation on both the upper limbs and the lower limbs. So now we're gonna go now is to check for the motor part. Okay, yeah, check for motors and motor abilities, which we're gonna check the strength of the muscle group on the upper arms first. So if you just can you raise the chair a little bit higher, please? Thank you very much, man. Okay. So first we're gonna do the upper arms and check the strength. Just put this back over there. First we're gonna check her deltoids. If you can turn over here. So I'm gonna push against her deltoids. She's gonna push back, so we can see her at first. If there's any weakness on those muscles. So first I'm going to hold this over here. I want you to push against it. Very good. So that's good strength over there. So now we're gonna check the biceps of this arm. So I'm gonna bend your arm. So what you're gonna do is I'm going to pull your arm a bit over here. Oh, there you go. I'm gonna pull your arm and you're going to pull back, okay? Okay, there's good biceps control over there, so there's no weakness. Next is gonna be the triceps muscle now. So what we're gonna do is I'm gonna pull her arm towards me and she's gonna push down back and counter it, okay? So here we go. Very good. Very good triceps strength over there. I'm gonna do the same with the other one. So I'm gonna, that's it, I'm gonna turn over this way. So for this one, I'm gonna test it and see. Very good. So that's good deltoid muscle over there. There's good strength, no weakness whatsoever. And now for the biceps now. Form an L shape, no, L shape. Biceps first. Loosen your arm, loosen your arm, loosen your arm. Okay. And I'm gonna pull and I'm gonna pull back. Very good. So there you go. So he's got a good bicep control and good strength. And now I'm going to pull this back up and you're going to push back down to check your triceps. Okay, here we go. Very good. There's no weakness whatsoever. Her strength is equal on both sides. There's no pain or anything like that right now. Okay, so very good. So we're good with the muscle strength. Both sides are equal. I didn't feel any weakness. There's good muscle tone on this side, and so now the next we can do now is check for hand grips. So I'm gonna have her grip my fingers so that you can grip them up and see how strong her grips are. So if you just hold of these and grip them as tight as you can. She's got very good hand grips. So the strength of her grips is not weak. It's normal, and bilaterally they're equal. And now we're going to also check for finger strength. So in this hand, please, if you lift your hand up, I want you to spread your fingers wide, and I'm going to try to close them up each, and I want you to counter the resistance, okay? Very good. Very good. Very good. Very good. So there's good resistance on these fingers. There's no weakness whatsoever. And we're going to do the same thing with the other hand as well. So fan them all out. So that's good. All right. Very good. Very good. Very good. So both fingers, the fingers on both hands have good strength. There's no sign of weakness. They don't seem to be having any problems as well. I think they looks like they have good capillary fill, and they look cyanosed. So the strength is actually good. So so far there's no problems whatsoever I can see from that one. The next part is we're gonna check for the lower legs now. So I would like to request the patient if she could lie down on the bed, please. Thank you very much. Okay. Like the upper extremities, we're going to also test strength of the lower extremities this time. All we have to do is we're going to apply a little bit of force or resistance on each leg muscle. And all she has to do is to counter that resistance, okay? So first we're going to check for your quads first. Yes, your quads. Which is going to be the upper part of the leg. These are the quad muscles over here. So what we're going to do is I'm going to try to push down, and all she has to do is to push back up. So we're going to do one leg at a time. So I'm going to push this down and try to lift your leg up and push it up. Very good. So there's good muscle tone over there, good strength. She was able to lift her leg while pushing me back. I should push it down. So we'll do the other quad this time again. So here we go. Very good. Okay, so that's also good muscle tone, no weakness whatsoever. And next we're gonna check is the hamstrings, which is the muscles behind the quads. So what I'm gonna do is I'm gonna raise your leg, what I'm going to do is I'm going to try to raise the rest of the leg up, and I want you to counter it by pushing it down, okay? Here we go. Okay, very good. So that's good leg strength in there. The hamstring seems to be fine. There's no weakness. So we're going to do the other one this time. So I'm going to raise your leg up here and try to counter it. Very good. So there's also good muscle tone and strength over there. No weakness whatsoever. And now we're going to check for the hips as well. We'll go over the hips is we're going to abduct and adduct each hip and chest for strength. So we're going to chest first is the right one. I'm going to flex your knees up, and then we're going to do the adduction first. So I'm going to push inward. I want you to push outward, counter my resistance. Okay?
Okay.
Here we go. Very good. So she's able to counter that. There's no problems with strength. There's no weakness whatsoever. And now we're going to do the abduction. I'm going to pull your hip towards me, and then you're going to try to bring your leg back in. Okay? Here we go. Okay, very good. So there's also good muscle strength over there, the abduction part. So we're good for this hip. Now we're going to try the other hip now. So I'm going to raise the leg up. And first we're going to do the abduction first. So I'm going to push it out, and she's going to bring it in. So here we go. Very good. So there's good muscle tone over there too, and good strength. There's no weakness. And now I'm going to do the adduction. So I'm going to bring your knee towards me, and you're going to have to push it back out. Okay? Here we go. Okay. Looks very good. So so her leg muscle seems to be okay. No signs of weakness. They're firm and well toned. So so far her motor sensors have been okay. There's no problem with strength. So the next we're going to do now is, the last part we're going to do now is check her reflexes. But since she's already lying down, we're going to do the first reflex. First we're going to do is the Babinski reflex, in which we're going to slide something at the base of her foot laterally, and we're going to see if the foot will fan out or will flex forward. Fanning out is a positive sign of pain. So usually the fanning is also only been seen by neonates and babies. So for adults, it has to be flexed forward. So what you're going to do is you start off for the ball or the heel, going around the lateral part and making a little J around. So we're going to just slide it slightly, and you can see the foot is actually flexing forward, which means her this is called the Babinski reflex. So it's good. So it's negative Babinski. So now we can try the other side now. Same thing, just slide forward on the side and little J, and you can see it's actually flexing forward. So she also got negative Babinski on that side, so everything is doing well for that. So the rest of the reflexes we're going to do sitting down. So if you want to please sit down back on the chair. Sorry. And now we're going to check the reflexes on the upper arms first. The first one we're going to check is the biceps, reflexes in the biceps. So we're going to tap the nerves over in the crook of the arm over here, and we'll see that if the arms would react to the tapping. Okay. There you go. That's good. Now for the other arm. There you go. So there's a reflex there, so everything seems to be fine on that side. So now we're going to check is the triceps one. So what we're going to do is we're going to turn it around here. We're going to hit the back of the arm over here, just above the elbow, and see if there's any reflex there when we hit it with our little hammer. Okay. Yep. So the reflex is good over there. Turn over side, let's see, please. Thank you very much. Hang your hand loose. And now try to hit the nerve on this side and see. Okay. There you go. So there it is. So there is also positive reflex on that side as well. And next we're going to check also the knee side, which is going to be the patellar ones. Can you raise the chair a little bit more up, please? Thank you very much. So you have more room. So the patellar reflex, we're going to be hitting just below the actual knee itself. So we're going to try the right one first. There we go. I'm sorry. Was that too hard?
That's okay.
Okay, I'm sorry about that. But as you can see, it reacted very well, so that's good. Now we'll try the other knee. Okay, that's good now. So I didn't hit this hard this time, but she still felt it, so everything seems to be fine with the knee reflex as well. And then the last reflex we're going to do is the plantar reflexes, which is going to be located on the ankles. So we're going to start with the right ankle first and see. Just hit on the side of the ankle inwards. Just hit right on that spot. There we go. So there's positive reflex over there. And then on this side too. There we go. Okay. So all the reflexes seems to be working fine. Everything seems to be okay with everything with the exam. The cranial nerves are all working fine. She has good muscle tone. She has no weakness. I didn't see any problems with the facial nerves. There's no drooping or anything like that, or weakness in the face too. So we are now done with the neurological exam. So I'd like to thank Ms. Jane Doe over here for being gracious with me and helping me out with this exam. So thank you very much for watching, and we'll all see you again next time. Thank you.